So we're starting a program for what's called sublingual immunotherapy. So these are essentially allergy drops, which are very similar to allergy shots. It's the same principle that you would basically give yourself a little bit of what you're allergic to in such small quantities that you'll make blocking antibodies to the allergen. So we basically have you put the drops under your tongue as opposed to you getting a shot in your skin. So the skin has a lot of reactors and processors, whereas the bottom of the tongue, or it's called the sublingual space, has a lot of processors, but not many reactors. So it's really pretty safe for you to do these at home, which is another benefit, as opposed to having to come to the doctor's office to get your shots. You can actually do this therapy at home. We have you do it every day. Plus, it may be hard for you to get here, so it may be more convenient for you to do your therapy at home. You only need to get a dropper bottle like once every 4 months, which is nice. So you can get like 4 months of therapy out of, we have 12 milliliters of drops in there. The other thing is, so I guess obviously everyone's trying to save money on gas right now with how expensive it is. The other thing is safety. There hasn't been any reported reactions with drops to the point where you get anaphylaxis or have to have an epi shot to go to the emergency room. That's not to say that we won't give you one of those to have at the house, just in case. But those are probably the biggest benefits. So we test for the allergies right here in the office, and in order to test, we have a device similar to this, which is called a multi-prick device. I don't know if you can see it. It has 8 different pricks that we can do at the same time. So we will test for around 56 to 58 allergens on adult patients and about 32 to 40 on children. But overall, we do the allergy testing here as well, right here in the office. So you'll see us get tested. We need to have you off your antihistamines in order to get tested. That includes eye drops that might be antihistamines or nose sprays. You can still be on your corticosteroid nose spray, like your Flonase or Nasacort or your Singulair, or steroids such as prednisone. It's still fine to test you with that. Doing this therapy is kind of like getting married. You want to know that you're going to be in it for the long haul, at least 3 to 5 years before you should consider coming off the drop. So, and compliance is a big issue. So we start you at a low level, and then we gradually increase the amount of allergen that's in the bottle for you, so that you get to the point where hopefully it's at the level where you would see it outside or inside. And then when it's presented to you that way, you don't have a reaction. That's really the key, is kind of gradually increasing it so your body doesn't have a reaction that continues to make the blocking antibodies. But it is a 3 to 5 year commitment. Some people decide to just stay on them for a longer time, such as myself.